Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, there are several urological problems like a kidney stone, urine infection and many more. So to discuss on all these, we have with us in studio Dr. Brojen Barman, consultant urologist from Health City Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for coming to Good Life, the health show. And in the entire episode, we are going to touch on the various issues, various diseases like a kidney stone, urine infection, which are all urological problems. So, but at first, what is a urology? If for the benefits of our viewers, you would like to make them understand what is a urology in general term.
Urology is a super specialty subject of surgery. So after surgery, we become a urologist after further training, 3 years of further training. So being a urologist, we treat the diseases of kidney, ureter, urinary bladder, prostate, diseases that affect the male genitalia, including the penis, scrotum, and testis. We also include the gland, a small gland over the kidney, those are called adrenal gland. All the diseases that affect these organs of the body, the urogenital tract, are treated by a urologist.
All right, so this is a little bit of general information about what exactly urology is. So what are the diseases basically you treat, and what kind of like patients you see through in your entire things whenever you go to your hospital, and you get a lot of different kinds of patients, like from kidney stone to urine infection. So there are a lot of diseases. So what would you like to tell on that?
Urology is a subject and our patients can range from a baby which is intra-abdominal, even before the child is born, the intrauterine, that's called female fetal medicine. A part of fetal medicine is also being dealt with by urologist. And from the birth itself, before birth rather, we stretch from childhood, adulthood, until the very old age, we have urological problems. And the common problem that we face being a urologist are diseases of stones, kidney stone diseases, urinary tract infections, various cancers of kidneys, prostate, testis and penis. And we also have issues related to men's health. So broadly, these are the topics we deal with everyday practice.
All right. So now you started with kidney stone. So let's talk about kidney stone. How common are kidney stone if you come across to patients? So how it's common, and the patients when they come to you that they come with a pain in their lower abdomen. So do they think that might lead to some kind of kidney stone, or what is all about basically?
The first thing is, how common are the kidney stones? Kidney stones are very common now that we have ultrasound in every nook and corner of our country. So a lot of people get their ultrasound done, and incidentally they might present with small stones or concretions. So if you do an ultrasound for 100 healthy people, for example, you'll find small stones in up to 2 to 5% of patients.
Okay.
So these are asymptomatic patients, incidentally diagnosed with kidney stones. But people also present with pain, pain abdomen. Okay, a lot of people think that if they have a pain in the abdomen, lower abdomen, or by the side of the abdomen, the flank area, we say they have got kidney stones, but it's not like that.
Okay.
The abdomen is like a Pandora's box, no? There are so many organs inside your abdomen. The kidneys are only one organ. No. So you may have a lot of other problems. So it's better when you have pain, abdominal pain, is better to consult your doctor.
That might be any kind of pain. So it's better to get diagnosed first, and then only we should come across with what kind of problem exactly you are facing. Doctor, we have a caller waiting. So let's take the call first, and then we'll proceed with the conversation. Hello.
Hello, মই আপোনালোকৰ অনুষ্ঠানটো চাই আছো। মোৰ প্ৰশ্ন এটা আছিল, মানে মোৰ অকমান ৰাতিপুৱা কি হয়, গেছৰ প্ৰব্লেম হয়, যিটো কাৰণে মই গৰম পানী খাওঁ, খুব বেছি গৰম পানী খাওঁ, 2 কাপ বা 3 কাপ। এতিয়া যেটো মই আপোনালোকৰ প্ৰগ্ৰাম চালো, মানে সুধিব বিচাৰিছিলো, গৰম পানীবোৰ যদি মই দিনটোলৈকে কন্টিনিউ কৰো, খাই থাকো, তেতিয়া কিবা প্ৰব্লেম এৰাইজ হ'ব পাৰে নেকি গৰম পানী খাই থাকিলে? এনেকুৱা কিবা কথা আছে নেকি যে আমি নৰ্মেল ঠাণ্ডা পানীটোৱে খাব লাগে, মানে কিডনিৰ ভালৰ কাৰণে?
আপোনাৰ ৰাতিপুৱা কি প্ৰব্লেম হয় বুলি ক'লে? gastric problem
gastritis.
Okay, gastric problem to মই deal নকৰো তথাপি আপোনাক কওঁ যে ঠাণ্ডা পানী বা গৰম পানী লৈ কথা নাই as long as the water is clean and it's portable, you don't get infection from the water you take. So apni jenuka pani khai bhal pai, if you prefer cold water or maybe warm water, it's okay as long as you drink safe water, and adequate amount of water. 10 to 12 glasses of water healthy, tatke beshi khaleo ki jani khub beshi labh na hobo. So as long as you are well hydrated, I think that should work well.
It should be lukewarm. It should be not that hot, but the process of but if you are drinking more liters of water, that it's good for health, isn't it? But it should be hydrated. Body should be hydrated.
Yeah, your body should be hydrated. Like we have a notion that if you drink a lot of water, you are not going to get stone disease or you are not going to get so many other diseases. It's not like that actually.
Okay.
When you take a lot of water, you pass a lot of urine. Why does it happen then? So your body doesn't need so much water, so it try to get rid of the excess water that you are taking. So you go to pass urine over and over again. So the more the water you take, probably it's not going to help you any better than the 10 to 12 glasses of water.
Okay.
Aru gorom ba thanda, as long as you prefer it any good temperature, it's just nothing like that.
All right, Doctor, kidney stone. So we were talking about that. It's very common, and we hear from many of the people that they have a pain in their lower abdomen. So is every pain related to kidney stone, and how a person, he or she, will come to know that the person is suffering from kidney stone? So initially, how to diagnose it at home, or you have to immediately go and see a physician?
So kidney disease are very tricky, There are two kinds of people. Some people will never have any kind of symptoms, They will be asymptomatic. Suddenly they will discover that they have got small stones in for ultrasound done for any other reasons, or they just don't know unless the kidney totally damaged, and then kitaba mane CKD hoy jay, kidney failure hoy jay, dui phale stone thake gome na paye, enuka hoy. So these are very unfortunate people because they are not aware. Pain is good sometime, it makes
to give you some signals, to give you some signs about it.
Yeah, it sends you signals to seek early maybe early diagnosis. Okay, so these are people who have asymptomatic stones, but a lot of people have symptomatic stones, so they will have pain abdomen. Side or pa hoy, usually back phale hoy, kidney tomar back phale thake. So by the side of the abdomen, or it might radiate to the lower abdomen or to the genitalia. Sob pain jibilak tol petor phale sob bilak pain je hoy, sob je kidney stone hoy enuka no hoy.
Okay. So all pains are not related to kidney stone. It's better to get you properly checked, and then only you might come to know that what exactly the problem is.
Yeah, and not all kidney stones also give rise to pain. That's another thing.
All right. We have a caller there waiting. So let's take the call, and then we will proceed with the treatment part about the kidney stone. Hello. Hello.
Hello. Hi.
আমি শুনি আছো, আপোনাৰ প্ৰশ্নটো কৰিব।
না প্ৰশ্নটো তেওঁকে সুধিম, ডক্টৰক সুধিম না।
ডক্টৰ শুনি আছে, আপোনাৰ প্ৰশ্নটো কৰক।
হেল্ল'।
হয়।
শুনি আছো, কওক।
হয়, তাৰমানে কি মোৰ কেতিয়াবা খুব জোৰকৈ পেচাব লাগে।
আচ্ছা।
কিন্তু পেচাবটো কমকে হয়।
ওকে।
হয়, কথাটো কি? এনে এটো কি কৰা উচিত?
আপোনাৰ বয়স কিমান?
এতিয়া মোৰ বয়স 52।
আচ্ছা। কি হয় একচুয়ালি আমাৰ যেটা খুব
কিন্তু এনেকুৱা নহয় যে গোটেই দিনটোত প্ৰত্যেকবাৰ পেচাব কৰোতে পেচাবৰ মানে যেটো নেকি গতি, এই গতি অনুসৰি একেবাৰে যে কম হয় তেনেকুৱা নহয়, কেতিয়াবা বেছিকে হৈ যায়। কিন্তু কোনো সময়ত ফিল হয় যেন যিমান পেচাব লাগিছিল সিমান পেচাব হোৱা নাই
বা স্লো আহিছে। So regarding his question, ke bahut jure pesab lage, enuka feel hoy je eta pesab korile khub bhalke pesab korim, jure pesab korim, hunkale pesab korim, kintu pesab koribo jale pesabur hunkale nolai. So it's like a balloon, our jot pesab jama hoy, ami urinary bladder boli ko, pesab jita jama hoy thake, it get distended, bahut dangor phuli jay, tar wall jitu thake thin hoy jay, it becomes thin. So ei wall to compress kori he pesab kore amar. তো আমি যদি বহুত দেৰি পেচাব নকৰো, গাড়ীত গৈ আছো, বহুত দেৰি পেচাব কৰিব পৰা নাই, তাৰ পিছত যেতিয়া আমি পেচাব কৰিব যাওঁ, আপোনাৰ মানে আপুনি যিমান ভাবে ইমান মানে হুনকালে ওলাই না যাব, ইট উইল টেক ইটস ওন টাইম। দেয়াৰফৰ যেতিয়া আমি ৰাতিপুৱা পেচাব কৰো, গোটেই ৰাতিটো পেচাব নকৰো, ৰাতিপুৱা যেতি পেচাব কৰো, মোষ্ট অফ দি টাইম উইল ফাইন্ড দ্যাট ৰাতিপুৱাৰ পেচাবটো আমাৰ স্লোলি ওলাই। as a physiologist, normal physiology. Kintu apunar age 53 years hoise, after 50 years, most of the male will have some or other prostate problem. I feel that you should go to your physician, get a checkup done, get an ultrasound of kidney, ureter, your prostate, bladder, kiman pesab thaki jay, aru ketaman blood test to koribo lagibo, kidney bhale ase na, serum creatinine for example, serum PSA, ebur test korile I think is better considering your age, 53 years male.
All right. Thank you so much for calling. I'm sure the question you have put just now must be benefited with the answer the doctor has given. So, Dr. Prostate will come to that, but let's talk about the treatment part of a kidney stone. If any person is being diagnosed with kidney stone, so what is all about? All right, we have another caller waiting. Let's take the call and then we'll proceed with the conversation. Hello. All right, the line got disconnected. We'll again try and connect to that caller again. So, treatment part about kidney stone.
Coming back to the treatment of kidney stones, the treatment of kidney stone depends on the size of the stones and the location of the stone.
Okay.
Small stone, for example, less than 5 mm, if it is located in the ureter, ureter is a very narrow tube connecting the kidney to the urinary bladder. So, tat jodi less mm, 5 mm ke less pathor ase, so most probably dobai tulai jabo.
Okay.
Jodi 10 mm ke dangor pathor ase, it's less likely that it will come out. So, anything in between 5 to 10 is a medium size stone, no?
5 to 10.
5 to 10. So, we can try it medicine. This is ureteric stones, okay?
All right, doctor, we'll again proceed with that, but we have the caller again waiting for us. Let's take the call. Hello.
হয় মই জানিব বিচাৰিছিলো UTI মানে কমন সিম্পটমস কি আৰু বেছি পানী নাখালে হ'ব পাৰে আৰু ৰেমেডিজ কি আৰু
Urinary tract infection, UTI বুলি কওঁ আমি short formত. UTI symptoms, common symptoms, দুটা ধৰণৰ UTI হ'ব পাৰে, কিছুমানৰ ফিভাৰ হয়, কিছুমানৰ ফিভাৰ নহয় UTI হলে. ফিভাৰ হলেতো গমে পাব জ্বৰ আহিছে আপোনাৰ, বা জ্বৰ নাহিলে কেনেকুৱা ধৰণৰ symptoms হ'ব পাৰে, with or without fever. বাৰে বাৰে যদি পেচাব গৈ আছে, suddenly all of a sudden বাৰে বাৰে পেচাব গৈ আছে, পেচাব জ্বলা পোৰা কৰিছে, পেচাব লাগিলে ৰাখিব দিগদাৰি পায়, বা পেচাবত যদি দেখে যে ৰঙা পেচাব হৈছে, আপোনাৰ পেচাবত তেজ গৈছে, these things may be suggestive of urinary tract infection. আৰু যদি লগতে জ্বৰ আহে, কপি কপি জ্বৰ আহে, that may signify some higher infection, maybe infection in the kidney. কিন্তু বহুত বিলাক infection asymptomatic ও থাকে UTI. So, UTI, it might be asymptomatic, it might be symptomatic, fever থাকিবও পাৰে, নাথাকিবও পাৰে, কিন্তু যদি আপুনি বাৰে বাৰে পেচাব গৈ আছে, পেচাব ৰাখিব দিগদাৰি হৈছে, পেচাব জ্বলা পোৰা কৰি আছে, these are the most common presentation of UTI.
All right. Thank you so much for calling, and the answer must be benefited for you. And if you have any queries, you can, and if you find any kind of problem, so it's better to see a doctor. You might find the exact problem and the treatment can be started at the earliest. All right, doctor, coming back to you again. We have again a caller waiting, so let's take the call. Hello.
Health exercise labo বিচাৰিছিলো মই পাম নেকি আনসাৰটো
কিহৰ বিষয়?
মোৰ দাঁতৰ প্ৰবলেম বাইদেউ দাঁতৰ টিয়াৰ্ছ হৈছে আৰু দাঁত ধুইলে মানে আপোনাৰ দাঁতৰ পৰা আপোনাৰ গোন্ধ ওলায়
যেহেতু আমাৰ আজি ডক্টৰ ব্ৰজেন বৰ্মন তেওঁ এটা ইউৰোলজিষ্ট হয় আমি
টিয়াৰ্ছ হৈছে এইটো মানে দাঁত ক্ষয় গৈছে দাঁত ধুইলে মানে আপোনাৰ দাঁতৰ পৰা অলপ পুজ ওলোৱাৰ নিচিনা হয় আৰু মোৰ মুখটো গোন্ধায় মানে
All right, we will try and give you that answer, but actually Amar Ajir studio urologist says, so we'll try, but he is basically trying to patch to a dentist. So thank you so much for calling, but if you have any queries regarding the kidney stone, urine infection, you can please call up. The numbers are flashed on your television screens, it's there, and please call. Dr. Brojen Barman is in our studio and he will try and give you all the answers. All right, doctor, coming back to you, we have several callers waiting and several callers calling about different kind of diseases, so we might get some different calls as well in between. So treatment about kidney stone, we were talking about the size of the stone.
So to continue with the treatment of kidney stones, that was about the stone in the ureter. So stones in the kidney, stones in the kidneys, we have several modalities of treatment. Now the most popular modality is PCNL. We make a small hole through the skin to the kidney. We break the stone with several sources of energy. For example, laser is there with us, and we remove the entire stone into after breaking it into pieces. So this is the latest advancement in the kidney stone surgery, PCNL, keyhole surgery.
PCNL.
PCNL, okay.
So these are very advanced technologies which have been upgraded.
Earlier people used to do open stone surgery, like
surgery.
20-25 centimeter big abdominal incision. So these are very rare now. We don't do open kidney stone surgery any longer. So that is PCNL. Another form of treatment is lithotripsy. We break the stone from outside.
Okay.
Now we use this as a modality of treatment less and less because we have so many other sources of energy. Another advancement in urology is the RIRS, no? Retrograde intrarenal surgery.
Okay.
Small stones which are inside the kidney with laser, with a very flexible instruments, we go inside the kidney without any incision, without any surgery, no scar, we do a surgery of the stone.
So these are some of the technical terms when any patient comes to you, make them properly understand about the treatment procedure, and whichever way they are comfortable with, then you go ahead with that, isn't it? All right, doctor, we'll talk more on this, but we have to take a short break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. We are still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion on different problems of urological, like kidney stone and urine infection. And doctor, we have a caller waiting for us, so let's take the call and then we'll proceed with the conversation. Hello.
Hello.
Ami khuni asu apnar proshno to koribo.
হয় মোৰ প্ৰশ্নটো আছিলে মানে মই আজি প্ৰায় এমাহমান আগত আল্ট্ৰাসাউণ্ড কৰিছিলোঁ তাৰপাছত মোৰ মানে 6টা ষ্টন ওলাইছে
6টা ষ্টন
হয় কিডনিত ওলাইছে এটা ইউৰিনৰ নলীত ওলাইছে
আচ্ছা দুইফালে আছে ষ্টন নে এটা কিডনিতে আছে
হয় কিডনি ৰাইট সাইডে আছে লেফট সাইডে আছে তাৰপাছত ইউৰিনৰ নলীত আছে মানে 6টা এটা 7 mm বাকি 4 mm 5 mm
আচ্ছা ইউৰিনৰ নালীত থাকা বুলি কৈছে যে এটো এক সাইডে আছে নে দুই সাইডে আছে
এক সাইডে আছে বুলি কৈছে নে
ওকে ওকে সো আপনার দুটা কিডনিতে পাথর আছে আর কিডনির এটার পাইপত যেটা আমি ইউরেটার বুলি কওঁ কিডনি নালীত তাতো এটা পাথর আছে এই পাথরটো সাইজটো কিমান যেটো নালীত আছে আপনার মনত আছে নেকি
এনা নলীটো হেটো এনে ৰিকোৱা নাছিলে এটা ডাঙৰ আছিলে 7 mm বাকি 4 mm 5 mm এনেকুৱা আছিল কিন্তু ইউৰিনৰ নলীটো ডাইৰেক্ট পোৱা নাছিলে
ওকে ওকে আপনার এটা সাইডৰ টু ব্লক আছে অলমান 7 বা 6 mm জি সাইজ কৈছে আপনি আমি মেডিসিন দি চাব পাৰো আপনা কেদিন মান ম্যাক্সিমাম 1 মান মেডিসিন দি চাব পাৰো যদি পাথৰটো ওলাই যায় বাকি হৰ হৰ পাথৰো আছে আপোনাৰ কিডনিত এটা 7 mm হল খুব বেছি ডাঙৰ নহয় কিন্তু আমি আপোনাৰ ন সিটি স্ক্যান সিটি ইউৰোগ্ৰাফি বুলি কওঁ সিটি ইউৰোগ্ৰাফি কৰাৰ পিছতে ক'ব পাৰিম যে আপোনাৰ ষ্টনবোৰ কেনেকৈ আমি ট্ৰিটমেন্ট কৰিব পাৰো দবাই দিলে ভাল হ'বনে কিবা প্ৰচিজাৰ কৰিব লাগিব হ্যাঁ তো আপোনাক চালেহে আপনি ভালকে ক'ব পাৰিম
তাহলে মেডিসিন খালে ওলাই যাব চাগে নহয় জানো
মেডিসিন খালে ওলাই যাব বুলি ক'ব নোৱাৰি কিন্তু ট্ৰাই কৰিব পাৰো 7 mm পাথৰ আছে কোনটো লোকেশনত বা আছে আজি কিমান দিনৰ পৰা হৈ আছে আৰু কিডনিটো কিমান বা সোয়েলিং হৈছে বহুতখিনি বস্তু চাইহে আপোনাক ক'ব পাৰিম
All right. Thank you so much for calling. I'm sure you must be benefited with the answer just doctor gave you. All right, doctor, coming back to the treatment part of a kidney stone, and can kidney stone be prevented? That also we want to know about it.
Regarding prevention of kidney stones, you know, if you have never formed stones, probably don't have to worry about the stones. Okay, so people who have formed stones, 50% of them will not form any stones. Okay, but the worst scenario is that another 50% will keep on forming stones. Every few months, maybe every few years, they will come to us with new and new form of stones. For example, this patient that just called up, he has stones on both the kidneys. One of the stone has dropped to the ureter. So this is a person who is likely to form stone over and over again over his lifetime.
Okay.
So how do we prevent these stones?
All right, doctor, we'll come to that prevention part. Let's take the call first. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় হয় এটা মানে মোৰ এই ধৰক এই এতিয়া 59 প্লাস হেৰি হৈছে মানে পেচাবটো আহিলে ধৰি ৰাখিব নোৱাৰো তাৰমানে ধৰক কেতিয়াবা বহুত টাইম থাকি যায় হাতে যেতিয়া মানে খুব মানে হেৰি হয় ধৰক পুৰৰ পৰা আহি ঘৰ পাম আৰু এতিয়া এই গেটৰ ওচৰ পালো মানে এইখিনি সময়তে মোৰ খুব মানে হেৰি হয় মানে আৰ্জেণ্ট হৈ যায়।
Okay.
আপোনাৰ বয়সটো কিমান ক'লে?
59 প্লাছ।
59 প্লাছ।
কিন্তু মোৰ BT9টো মোৰ ঠিকে আছে, 0.80 আছে।
ওকে, ডায়াবেটিছ আছে নেকি আপোনাৰ? ডায়াবেটিছ, ব্লাড প্ৰেছাৰ কিবা?
মই ডায়াবেটিছটো এতিয়াও চোৱা নাই তাৰমানে।
আচ্ছা আচ্ছা, নে আপোনাৰ মোৰ লাগিছে আপোনাৰ প্ৰষ্টেট প্ৰব্লেম হ'ব পাৰে। আপোনাৰ বেচিকেলি কি হয় যে পেচাব লাগিলে ৰখাব নোৱাৰে, বিশেষকৈ যেতিয়া ঘৰ আহি পায় বা যেতিয়া বাথৰুম ক'ৰবাত দেখা পায় তেতিয়া মানে আৰু আৰ্জেঞ্চি বাঢ়ি যায়। বজাৰৰ পৰা আহিলে ঘৰৰ গেটৰ সোমোৱাৰ লগে লগে মানে আপুনি আৰু ৰখাব দিগদাৰি পায়। চ' দিছ ইজ আৰ্জেঞ্চি, Urgency is one of the symptoms of enlarged prostate. So in urgency what happens is that you are unable to postpone your urination. পেচাব আহিলে বিৰাট জোৰে পেচাব আহিলে ইমিডিয়েট পেচাব কৰিব লাগিব। আৰু কেতিয়াবা এনেকুৱা হ'ব পাৰে যে পেচাব ৰাখিব দিগদাৰি হৈছে, পেচাব কাপোৰত লিক হৈ যাব পাৰে বা ওলাই যাব পাৰে। দিছ ইজ আৰ্জেঞ্চি। আপোনাৰ এইটো চিমটম হৈছে আৰু আপোনাৰ বয়সো 59 ইয়াৰ্ছ। আই থিংক আপুনি লোকেল ডক্টৰক দেখাওক, কোনোবা মেডিচিন ডক্টৰ যদি আছে বা কোনোবা ইউৰলজি যদি ওচৰত আছে আপোনাৰ, এবাৰ আল্ট্ৰাচাউণ্ড কৰক, পেচাবৰ কেইটামান পৰীক্ষা কৰি চাব লাগিব আমি, ব্লাডৰ কেইটামান পৰীক্ষা কৰি চাব লাগিব। দেৰ আৰ ভেৰি গুড মেডিচিন নাও এ ডেজ, লাইক 80% অফ দি চিমটমছ কেন বি ৰিলিভড উইথ দ্য মেডিচিন। দ্যাটছ এ ভেৰি গুড নিউজ ফৰ অল অফ আছ। অ'কে, মেডিচিনছ আৰ ভেৰি ইফেক্টিভ। চ' প্ৰপাৰ মেডিচিন যদি খায় 80% চান্স আছে, মে বি মোৰ দেন 80% দেৰ উইল বি ৰিলিফ।
So that's a very good news also, and that's a very good information for our viewers that medicines can cure and you don't have to go for any kind of like surgery.
Not necessarily.
It depends on the case study and what kind of like case you are, what kind of the depth of the disease you are going through it. But if medicines can heal it, that's a very good information and a very good news for everybody. So doctor, we have another caller waiting. Let's take the call. Hello. The line got disconnected, so let's quickly finish the prevention part of a kidney stone.
To prevent stones for people who already have stones, have undergone treatment or surgery for stones, so what ki important pani 10-12 glass pani khabo lagibo daily. Ar kichon manu mas mangso beshi khaye, mas mangso koni, so try to take in less amount.
So this we are talking about the persons who are already affected with kidney stone. Prevention.
So কিছুমান ভেজিটেবলৰ পৰা হ'ব পাৰে, যেনেকৈ ফুলকবি, বিলাহী, বেঙেনা, কচু, ৰঙালাও, they have a lot of oxalate in them, no? Oxalateৰ পৰা stone হয়. Most of the Indian patient, they will have calcium oxalate stones. 85% of them will have calcium oxalate stones. So try to decrease those vegetables which are a lot where you have a lot of oxalates, nuts আৰু চাহ, কফি যদি কোনো খুব বেছি খায়, salt containing food, for example, too much কিছুমানে কেঁচা নিমখ লৈ পেলাই খায়, fast food খায়, so they have a lot of salt content in those things. Okay, try to cut down your salt. If you are overweight, try to decrease your weight. Blood pressure, diabetes থাকা মানুহৰ আমি দেখিছো যে stone disease are more and more prevalent among them. So try to control those diseases with medication.
So these are really very good informations and very good like points which you have mentioned, because like these are the things we try to sometimes like accidentally avoid it, or we try and just ignore it because taking extra salt in your food, and then those kind of vegetables you were talking about, so we didn't knew about it. So maybe the viewers who are watching our show must be knowing things, the little informations but very informative things which you are mentioning at this point in time, like those kind of things which is harmful for your body, it should be ignored at the earliest, isn't it? So what are the other things, like if we talk about the dietary part, you talked about like lots of water intake, it should be necessary because your body should be hydrated. That's very important. So a person suffering from kidney stone can take more water. Is it like okay for that person, or we have just heard someone that we should not take more water when you have a kidney stone?
Regarding kidney stones, okay, when a person suffers from kidney stone, we ask them to take plenty of water, 10 to 12 glasses of water. That is the general advice that we give to so many people, but if your kidney are failing, because of stone, kidneys are not working well, okay, or if you're undergoing some kind of dialysis, renal replacement therapy, where the machine will just filter out a lot of excess water. In case you end up drinking a lot of water in those scenarios,
it will drain out all the water.
Yes, you will harm yourself.
Okay, so that is for the extreme case, and that can only be
most
known
of the time, we prefer that the people who have stone disease, they take adequate amount of water, 10 to 12 glasses. And what water does is that it's not going to prevent your stones, but the stones will be occurring. Stone become larger by crystallization. All the crystals crystals, they come together. So if you take water, the crystals will be washed away. They will not have time to aggregate and form a bigger piece of stone. Is that
all right, doctor, we are really short of time. So on last note, what message and what kind of like preventive tips you want to give to our viewers who are watching our show?
Kidney is a very vital organ. We talk about brain, we talk about so much about heart diseases, but the kidneys are neglected. You know, a lot of people are not aware of kidneys and the urological problem. This is, I think, because of awareness problem.
Okay.
So I would say that if you have a healthy kidney, you have a healthy life.
All right. Thank you. With those positive note, we'll try and finish the episode at this point in time. But there were lots of topic to be touched on. We didn't get that much of time. But thank you so much, doctor, for sparing those time and coming to our studio and giving those informative message to our viewers. And with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.
Goodbye.